I have a low AMH level. What should I do? Now, for infertile women, AMH, anti-Müllerian hormone, also known as MIS, Müllerian inhibiting substance, has become the standard marker for egg quality. It provides us with quantitative measures for checking ovarian reserve and measures both egg quality and quantity. Now, in the past, we had to depend upon FSH levels. A high FSH level suggests poor ovarian reserve, but FSH levels are not very reliable because they vary according to which day of the cycle the test is done and can also be artificially suppressed by a high estridiol level. AMH is a much better marker for ovarian reserve. It does not vary from cycle to cycle and remains the same throughout the cycle. Now, a low AMH suggests you have poor ovarian reserve. Even if your level is low, this does not mean that you should panic. Remember that it's just a test and good doctors do not treat tests, we treat patients. Step number 1 is to repeat it again, preferably from another lab, and step number 2 is to run an additional test to check your ovarian reserve. This is called an antral follicle count and is done by doing a vaginal ultrasound scan on day 3 of your cycle. Even if these are poor, this does not mean you cannot improve it. While Western medicine does not have much to offer, there are alternative medicine options you can try to improve your ovarian reserve. These include the following. Number 1, yoga. Number 2, acupuncture. Number 3, DHEA, 25 milligrams thrice a day. Number 4, vitamin D3, 60,000 IU, once a week for 10 weeks. Women have tried other supplements such as royal jelly, MECA, wheat germ, and CoQ, but there's no proof that they really help. This is all empiric therapy. If you have not been trying for too long, do remember that young women with low AMH levels do also get pregnant on their own, although their chances are reduced. After all, levels provide information about groups of women, and there can be a lot of individual variability. IVF with aggressive superovulation would be your best option, as it would maximize your chances of getting pregnant quickly and help you make the most of the eggs you have left. It allows us to telescope time for you. The problem, however, is that often poor quality eggs result in poor quality embryos, which means that your chances of implantation are poor, and you need to be prepared to accept this bitter fact. Plan B would be to consider natural cycle IVF, and Plan C would be to use donor eggs if you are willing to consider this option. This has a much higher success rate. For heaven's sake, please do not allow your doctor to do surrogacy for you if you have a low AMH level. Surrogacy is an expensive and complex treatment option, which is best reserved for women without a uterus or whose uterus has been irreparably damaged. For women with a low AMH, the problem is with poor egg quality. Your uterus is usually perfectly normal. Transferring your embryos into another woman's uterus makes no sense at all and will just waste your money. You can find out more about how we take care of our patients at www.drmalpani.com.